To start off with their mask, we will first make the mouthpiece mold. Here, I am mixing the white and blue molding putty by hand. Once it is fully combined, I roll the putty into roughly a 2-inch long, 1/4 inch diameter cylinder and pinch off around a 1/4 inch off the end as a test piece. With the remaining putty, I wrap it around the bite lock mouthpiece. Now we are ready to place the mouthpiece into the patient's mouth and have them bite into it gently, and let the mouthpiece harden for 5 minutes to set. Use our test piece we set aside earlier to confirm the putty has fully cured, and remove the mouthpiece mold from the patient's mouth. After rinsing it off with water, we reinsert the mold to ensure it fits properly. Now we can start positioning our patient onto the MRI table. Let the patient's head temporarily rest on the pillow. Additionally, I am placing a knee wedge underneath the patient's knees. With that done, we can get started on the Accuform head cushion. Here, I am activating the cushion with water and massaging it in to evenly distribute the water. I now replace the pillow with the Accuform cushion and start personally customizing this mold to the patient's head. I am pushing the mold gently onto the patient's head to ensure it forms properly. The patient requested warm blankets, so here I am putting them on her. And now I am checking if the Accuform mold has finished hardening. With that out of the way, I will now reinsert the bite lock mold into the patient's mouth. I am now placing the Civco open face mask into the oven at 165 degrees Fahrenheit for 8 minutes. Now I can take it out and let it sit for roughly 30 seconds until it does not burn to touch. You can test the heat by placing it on your own skin. For this next step, getting help is recommended. Here, we are wrapping the Civco mask on the patient's head starting from the jaw to the top of the head, making sure to clip the mask into the head frame. Here, I am clipping the mouthpiece into the mask so it bonds together. Now we press the mask gently onto the bonier, firmer parts of the face so it fits properly. While the mask is curing, I am positioning the patient with lasers so that for the future radiation brain surgery, the patient is in a recreatable position. Once I have lined up the patient, I mark 3 points on the mask where the lasers intersect. Finally, once the mask has molded, I can unclip the patient, clean up the area, and send the patient on their way.